Hi, I'm Elisa Newman, and I'm here to tell you about Fragile X syndrome. Fragile X syndrome is a genetic disorder. It's caused when there's a mutation in the Fragile X mental retardation 1 gene. This gene is located in the X chromosome, and the purpose of this gene is to produce a protein that's needed for typical brain development. Those that have Fragile X syndrome do not produce this protein. As a result, it ends in a very frequent, the most frequent form of an inherited intellectual disability. It can impact both males and females, but it has high prevalence in males because males only have one X chromosome while females have two. Because females only have one, they're often more times the carrier of the gene, with only about 1/3 of them actually having the intellectual disability as a result. With the boys only having one, it increases the chance of them having impact from it. In order to diagnose it, it is done directly by looking at this gene in cells that are from a blood sample that you can get either from your doctor or a genetic counselor. It's often first diagnosed in young children. On average, it's on kids around 3 years of age due to them having either absent or delayed speech, and that kind of leads to more further testing and finding this Fragile X syndrome. I kind of had a mixed amount of kind of how many individuals per gender it impacts, but I went with the book's numbers. So Fragile X syndrome impacts about every 1 in 4,000 males versus every 1 in 8,000 males. So as you can tell, there's a lot higher prevalence in males, just about twice as often as the females. And sometimes it can be diagnosed in the family as hereditary if they have things such as family history of autism spectrum disorder, intellectual disabilities, neurological problems, or early menopause. There are some developmental implications from it. As you can see in this picture here, physically, there are a lot of characteristics. Large ears is a common one. A high forehead, flat feet, long face with jutting jaw, hypertonia, which is stiff muscles, enlarged testicle for boys, a lot of ear infections, high arch palate, and hyperflexible joints, specifically in the fingers. Behavioral, there are things such as attention deficits, hyperactivity, self-injury, like I state below, that kind of go with like the hand biting or the head banging. And oftentimes these children or individuals are kind of hard to determine if they have a lot of the same autistic behaviors, so further testing is shown for them to have FXS and not just autism. For language and literacy, like I said, oftentimes there's delayed or absent speech. They can have social anxiety, poor eye contact, and be very impulsive. Oftentimes they have sensory disorders, and then again, the main thing is that those with FXS have intellectual disabilities that can range from anywhere from subtle to very severe. For the treatment and intervention, there's not a specific cure for Fragile X syndrome, but there are some treatments and support services that can kind of help those that are impacted, specifically around developing skills. When I looked for medications, sometimes they are used in more severe cases of those maybe that have seizures from it, but those behavior problems, like I said before, like anxiety or aggression, medications that are being used. However, they are trying to come up with some new medications that are specific to treating FXS. One interesting thing I read about was this genetic approach that's less practiced. What they had done was a couple labs had attempted to genetically rescue the phenotype and really restore the gene activity. Again, they had a couple studies where they felt they had some success, but further studies are definitely necessary. Therapy is a very common treatment for FXS, especially cognitive and behavioral. Those have been found to be beneficial. And then again, I read a lot about how they're trying to come up with specific targeted treatments just for FXS. One educational or application, which I really look at, it's kind of like the treatment and intervention as well. Special education is often found to be beneficial to kids with Fragile X syndrome, especially those that have been diagnosed early on in their life. To support these children are through inclusion, having them be part of a general classroom with some extra support such as paras so that they can be with their typically developing peers. And again, an enriched environment has been reported to kind of improve several cellular and behavioral deficits. So with that extra support and that enriched environment having great outcomes. One thing to consider is cultural and diverse differences. It's important to learn about an individual with Fragile X syndrome and their family's cultural perspectives and viewpoints on disabilities. Everyone kind of views disabilities differently. And then also to be self-aware of your own beliefs, biases, and behaviors is key to providing the best support by hearing what they want and also looking through their lens. Resources for family. Having resources in one's community can definitely increase confidence in managing FX syndrome. There's a couple cool ones I found. You can contact the National Fragile X Foundation either on phone or through email information and therapies and treatments in your area. Then there was a really cool thing called Community Support Network that is organized and run by parent volunteers, so I felt that was very inclusive. There's some stuff on social media. There's lots of Fragile X groups on Facebook from all over the world. Bowling Guy specifically provide a list from Chile, so I thought that was awesome that from all cultural and language groups you can kind of find support. They have some awesome Fragile X support boards on Pinterest, as well as a couple books I included. Thank you.